Our next speaker is Coertze from the private practice group professional officer at South African Society for Physiotherapists, SASP. So representing SASP, she is going to be talking, let me just get my... So, as I said, she's from the South African Society of Physiotherapy, which is the largest national professional body representing physiotherapists across South Africa. She's committed to advancing the profession. The SASP provides comprehensive, continuing professional development, evidence-based clinical resources, advocacy, and opportunities for professional collaboration. Its accredited courses, webinars, and events delivered through the private sector, public sector, and special interest groups strive to promote excellence across diverse areas of practice. As a founding member of the World Physiotherapy Association, the SASP contributes to global professional standards while strengthening the local healthcare landscape through ongoing stakeholder engagements. The organization supports ongoing research and student development through mentorship, funding, and engagement initiatives. Through education, clinical guidelines, and public awareness efforts, the SASP enhances physiotherapy practice and supports better health outcomes nationwide. So thank you so much for joining us. And I just want to say from my side, I'm an OT, and I just want to encourage, if you don't belong to a professional association, please do join. I know a lot of people say, oh, but what do they do for us? There's so much work that goes on behind the scenes. And please remember that the people like Karen who are on those boards, it's voluntary. So they give freely of their time purely for the passion for the profession. So whether you're a GP, whether you're an OT physio, please consider joining your professional association. Thank you so much for joining us.
Rehabilitation. It restores the ability to move, think, see, and communicate. In the 21st century, health systems are confronted with new challenges. With global aging populations and an increased number of people with chronic conditions, more people are living with disability than ever before. For health systems, this means a shift in services that don't just reduce mortality, but improve functioning and quality of life. And this is what rehabilitation is all about. As countries develop and health services improve, rehabilitation is needed to make sure people get the best possible outcome after an injury or illness. It means getting out of the hospital sooner with less risk of complications and less need for ongoing support. But in many parts of the world, people don't have access to the rehabilitation services they need. Insufficient numbers of trained rehabilitation practitioners, lack of services, and barriers to access, such as high out-of-pocket expenses, are challenges we have to address. Rehabilitation is key for the health of populations in the 21st century. Now, more than ever, we need to take action to ensure that everyone can access quality, affordable rehabilitation services.
Good morning, everyone. Thank you for being here this morning. Being a physio, I've got a passion for exercise, movement, and rehabilitation. And I think our society as well supports the development of that very well. So I just want to go... So I belong to the society, and I'm fortunate to be a little bit paid, not only voluntary. And then as physiotherapists, we believe movement is health, and it is so important to keep moving and to keep people going. And it's basically medicine. So I'm passionate, as a physio, I'm passionate about movement, function, and keeping people independent for as long as they can. So rehabilitation is not, it's not a phase that just comes in a phase of care. It's actually a continuum that starts when there's a health threat or there's an incident in your life, and then basically it never stops after that. So it keeps on going. And it's not just for people with injury and stuff. I think rehabilitation as the doctor said, it's the movement that you keep going. It actually stays for life. So what is rehabilitation? It's basically a set of interventions designed to optimize functioning and reduce disability in individuals with a health condition in interaction with the environment. So, when does someone need rehab? Rehab is for people who is experiencing limitations in their daily activity life, daily functioning in their activity life, and that can be due to aging, or it can be due to a health threat or a health condition. Now, what counts as health conditions? It is any disease, disorder, injury or trauma, and it can be other stuff like pregnancy, aging, stress, and then congenital anomalies or genetic predisposition. So any of that will need rehab. What is the key principles of rehab? The key principle is early initiation, and I think it ties in with what the doctor said before me, is that early diagnosis, early intervention, because if you can control it, it's so much better. So people need to have that intervention early. It is interdisciplinary collaboration. Like Tasneem said, she's an OT. We need to all be part of the multidisciplinary team. It needs to be person-centered, so it's the same message. It is not a general thing. It needs to be specific for the person. It has to have a goal. You have to have a goal that you can drive to actually do the rehabilitation. And then it must be context-specific. So if it is for a baby in development stages, or if it's later for if there's environmental stuff. So it has to be specific for the situation. And then it must, a very important part of rehabilitation is participation. It can't just be focusing on the impairment, but there's no participation from the person. So what is the aspects of rehab? The aspects of rehab is obviously exercise is a very, very important part of rehabilitation. And that is to improve your coordination, your dexterity, and your movement. And then interventions. There's certain specific interventions to improve safety and independence, to optimize the surgical outcomes after they had surgery, like a knee replacement. There's development for the children. It's for development outcomes that you look at. For, say, for instance, cerebral palsy. There's specific outcomes that you can achieve with them. There's increase of physical activity in specific, like mental health. There's a quite good correlation. There's a good correlation between physical activity and treatment of mental health, and especially with depression. And then there's the activities and intervention to support daily activities and daily living. How do they cope in their own activities at home? There is also important for them to be part of a community and to actually get community access. And then the other stuff is advice and education. That is extremely important part of rehabilitation. And that's where the participation also sets in. People need to know, they need to buy in, and they need to know what to do when you as a therapist or the medical professional or the support is not there. So they need to have that advice and education so that they can actually function and do things on their own. And then a big aspect of rehabilitation is to sometimes have an appropriate device. And that is one of the things that is actually limited in certain countries and problem to rehabilitation. So what is the current status in the world? So people are living longer, longevity, and but they're living longer, but there's a lot more disabling chronic conditions, and that impacts on the functioning and the well-being. So globally, 1 in 3 people lives with a health condition that could benefit from rehabilitation, which ends up to be 2.4 billion people approximately across the world. And it's basically across lifespan, so it's not just the elderly, it's actually in children because of the congenital issues, it is young adults, and it can be physical injury, people doing car accidents, whatever. So it's across the whole span. Even now, looking at the war, there's a lot of young people that has war-related injuries that's going to need rehabilitation. And then in older people, it's the aging and the chronic diseases. So the prediction is that in 2050, the population over 60 will be double than what it is now. And there is definitely a rising prevalence of non-communicable diseases. So many countries are not equipped for the existing rehabilitation need. And the forecast is that it will even worsen as the chronic diseases rise and as the demographics also, the trends changing. So the reason why it's a problem is rehabilitation doesn't get prioritized. It is under-resourced. In first world countries, it's often the medical schemes not paying for the rehabilitation. But in other countries, it's because it's just not accessible. In the rural areas, it's not accessible in a lot of things. So it's the under-resourced part of medicine. So the other thing is the access. People just have no access to get to the rehabilitation services. And then that will exacerbate their condition. It will give other complications. And in the end, it has lifelong consequences. So in some low and middle income countries, more than 50% of people do not receive the rehabilitation services that they actually require. And that is a huge statistic, more than 50%. I mean, that is like really large. So in 2017, the World Health Organization recognized that rehabilitation is a problem and that the access to rehabilitation is causing long-term increases in the need for rehabilitation. So they looked at all this stuff. It was the underdeveloped rehabilitation services. It was the unmet needs of the specific individuals. So the World Health Organization's members, society, civil society, and then some of the other developmental partners got together, and they actually came up with the Rehabilitation 2030 initiative. And the reason for that was because they realized that it's almost like a bomb waiting to explode if rehabilitation doesn't get addressed. So they looked at integrating healthcare rehabilitation into health systems and how that could be achieved. They look at equitable access, the strengthening of health coverage in various areas, all stages of the course of, so it's throughout all stages of the course of life, so it needs to be addressed in all the levels, not just in the elderly. They create strong leadership and political support, because a lot of times that is what the problem is in all the countries, is there is not an interest from the political side to actually implement these things. So that is what they're trying to give more support in countries to actually get that leadership going. And then that must be on subnational, national and global level. And then since they've started with this, WHO has already supported 78 countries to start improving their rehabilitation services. So there is I've put a link there, so if you do get the presentation, you can go and look at the full report if you want to. Otherwise, you can just find it on the WHO website. Okay, so the World Health Assembly then in May 2023, they decided to endorse this whole Rehabilitation 2030. And it was the first time in 75 years that rehabilitation was recognized as a global public health priority. So it's not just more luxury, it's not now just for secondary, it's actually becoming a public health issue. And with our NHI coming in, we are fighting very hard to have actually rehabilitation being recognized at a primary care level. So the World Rehabilitation Alliance was launched in 2022, and that was a network of some of the member states of WHO that got together, and through advocacy, networking, and knowledge sharing, they are supporting this whole Rehabilitation 2030 and trying to raise awareness and promote the rehabilitation as an essential care and not just a luxury. So there's also a link for the World Rehabilitation Alliance that you can go and see what they stand for and what work they are doing. So from the report or this initiative, they looked at 10 areas. I'm not going to go through all of them, but they are there. So it's basically the leadership, as I mentioned, it's finances, it's looking at the workforce. Is there enough people to provide the services? Even if they get funding for more rehabilitation, do we have the workforce? And it is actually one of the problems, is that there is not enough rehabilitation workforce. So yeah, and then also just networking and assisting each other and how developments can improve in that aspect. So the key objectives was strengthening the health systems to provide high quality rehabilitation services, integrate rehabilitation into primary, secondary and tertiary healthcare, and not just in the secondary and tertiary. Rehabilitation as essential part of UHC, which is universal health coverage, and sustainable development. So that was the key objectives of this program or this initiative. And then they also had to look at regional considerations. So challenges in countries like Africa, I'm sure we all know and have experienced some of the challenges. But it's limited access to qualified professionals, and especially in our country, maybe there is still a lot of professionals in rehabilitation, but there are some countries that really have very low workforce in the rehabilitation settings. There's perceptions of disability, which is often in Africa, that's a cultural thing. It's seen sometimes as a curse, or there's some other aspects which then limits the progression with those patients. And there's gaps in integrating rehabilitation in the primary care because, again, it's usually funding and it's a problem. So they try not to do it in primary care, but it's now becoming an essential. It's not a luxury anymore. So additional factors increasing disability in Africa at an alarming rate is the high incidence of traffic and workplace accidents, the complications of medical interventions if it's not being properly followed up, and there's a lot of things that's happening, complications, and it not getting treated in time. Natural disasters and conflicts, poor access to education, and then the communicable diseases like malaria, poliomyelitis, and leprosy, and then non-communicable diseases like diabetes, hypertension, and cancer. That's all on the rise, and that's creating a much bigger need again for the rehabilitation services, which is limited. So addressing these challenges is critical to achieve the Rehabilitation 2030 goals. So what is the benefits of rehabilitation? I'm sure that every one of us sitting here at some point in our lives, will have a need for rehabilitation. Some might have it on a much longer ongoing level, and some might have it on a much smaller level. But the fact is, we all most probably at some point in our lives, we are all getting older, we are all at risk of accidents or things that happen. So it is possible that we all will have to have rehabilitation at some point. So I've mentioned before, it is person-centered and it needs to be targeted with goals for that specific person. And that is the good thing about rehab. It can be like that. It can actually be patient-specific and working with that patient's functionality. Then the benefit is that it will reduce the impact of diseases. So like acute and chronic diseases, if you do have a chronic disease and you do have the proper rehabilitation, it will slow the process and it will also keep you functioning for much longer. It complements the other health interventions. It facilitates recovery and achieve the best outcome possible. It prevents, reduce and manage complications and specifically pain as well. So none of us like pain and none of us want to live with pain. Unfortunately, there are so many people that live with chronic pain. And through rehabilitation, they can also have some benefit to actually have a better quality of life. Then we want to minimize and slow down the disabling effect of chronic diseases. It equips people with self-management strategies, as I mentioned before, that if there's no people around, there's no carers around, that they can at least still do some function and have some abilities to self-manage. It contributes to healthy aging. As the doctor said, we all want to live until we're very old and not just live until we're old, but have a quality of life until we're old. So rehabilitation definitely benefits healthy aging. And then it also has the social, economic, and other health benefits to it. So rehabilitation is an important part of the UHC, and it is also a key strategy for achieving the World Health Organization's Sustainable Development Goal 3, which says ensure healthy lives and promote well-being. Sorry, people. It's my phone. Ensure healthy lives and promote well-being for all at all ages. It's a very wide goal, and I think it's a very high goal. But anyway, that is one of the aims of rehabilitation. So why is global rehabilitation needs unmet? So it's a lack of prioritization, it's funding, policies that's not in place, and plans at national level. And one of the plans at national level and international level that is really a problem is when things happen like natural disasters. It's always a sign that there wasn't really things in place for having that implementation if things go wrong. So there's the problem with the policy makers, it's not always priority. There's a shortage of services outside urban areas, and I think our country is a very good example of that. We have like all these people in Sandton and all these people in certain metros, but then going to the rural areas, we really have a problem with workforce. There's long waiting times, and that is becoming, I know I worked in the UK, and that was like 18 months for a cardiac bypass. There was like long waiting areas. That was many years ago, but I don't think it has much improved. But that is the problem why things also, it's a limitation to the rehabilitation. It's high out-of-pocket expenses. A lot of people can't afford to get the services. It's non-existing. There's non-existing or inadequate funding. And as a physiotherapist, we're seeing more and more of that in the hospitals, that the schemes are cutting rehabilitation. They will do the knee op, they will do the surgery, they will do the ICU admissions, but the rehabilitation part is getting less and less funded. And we understand they all need to cut funds, but that is unfortunately a priority that is getting cut. And it's increasing hospital stay and all of that. So there's not enough rehabilitation professionals. Some countries have less than 10 skilled practitioners per 1 million population, and insufficient resources, little research on data on rehabilitation, and that is one of the biggest problems in rehabilitation professions. We don't have support funding much. Like in the medical profession, there's a lot of pharmaceutical companies that does a lot of research and stuff. For the rehabilitation services, unfortunately, that is not the case. So the medical schemes will ask you, what is the data? Show us the data. But we don't have the data because there is not enough research. So that is one of the things that was also identified in that initiative, that there needs to be more funding for research. And then ineffective and underutilized referral pathways to rehabilitation. There's a lot of people that or medical professions or interprofessional even, they don't refer on. They don't think of rehabilitation as a priority. So there's a lack of referrals. And then the poor health system readiness and emergencies, as I mentioned before, is one of the big things. So rehabilitation is actually an investment. Although it's costly, it is not as costly as many other interventions. There's cost benefits for the society and the individual. It does reduce and prevent costly hospitalization. It reduces the length of stay in hospitals and they prevent hospital readmissions. And that is specifically very true in COPD. I worked in the UK and I had to do a trial and a test series for 6 months to show the benefit of pulmonary rehabilitation. And the benefit was so big that the hospitals actually started implementing it as a service. And that has shown to reduce the admissions and readmissions of people with COPD. So pulmonary rehabilitation is one of those aspects of rehabilitation that is really effective. And I've got some other stats about that a bit later. So rehabilitation enables people to participate in education, to gain employment. So there's quality of life for them because they can actually go back to some of the stuff that they couldn't do anymore because of their incidents or their health condition. And it enables also some independence at home, and it minimizes the need for financial and caregiver support. So for more information about that rehabilitation program or initiative, like I said before, it is on the WHO website. So where does physiotherapy fits into this and into the rehabilitation continuum? We are basically experts in movement and exercise therapy. We are the biggest rehabilitation profession in the world with the biggest and the largest workforce, and we are central to rehabilitation teams and to rehabilitation. We play an essential part in service delivery, and it's not just the rehabilitation itself, but it's on a promotion, prevention, intervention, and then the rehabilitation. And it is a cost-effective service. Although our costs are getting cut all along, our costs are still much lower than hospitalization, much lower than surgery. So even though it is costly to have physiotherapy, it is actually some of the cheaper aspects of rehabilitation. It's integral to be part of a multidisciplinary team and work together at the same goal for the patients. It's involved at any stage of life, as I mentioned before, from neonates right through to the aging. It's involved in all the fields. There's no medical field where rehabilitation and physiotherapy is not actually involved. Then it concerns this, we look at the physical, but we also look at the psychological, emotional, and the social well-being of patients. So we do, as physios, we look at the whole of the patient, not just the certain aspect. And then we are governed internationally by World Physiotherapy, and our society, as Tasneem mentioned, has been one of the founders of World Physiotherapy many, many moons ago. How much time do I have? 15. 15, okay. So physiotherapy prevents impairments, activity limitations, participatory restrictions, disability and injury, and then it also promotes and maintains health, quality of life, workability, fitness, and well-being. So the scope of settings where we actually operate is public, private, and voluntary sector settings. It will be hospitals and step-downs, rehabilitation centers, community and primary care health centers, home visits, nursing homes, schools, sports venues, workplace. We look at ergonomics, education, pre-employment screening tests, risk management, and then educating the workers, like lifting and handling techniques. We also work in private practice, which is obviously a lot musculoskeletal, but there's also neurology and a lot of other areas that works in private, and then the clinics. I, for instance, myself is involved with a clinic at our church. They started a medical clinic for people with no funding and that can't afford to go to doctors or physios. And that is something that is a community-based, and it is something that you can give some time to and actually get involved. So there is a lot of opportunities where we can get involved in that type of thing as well. So the physiotherapy is across all levels. It's primary, where we do mostly prevention, screening, early detection, and education and lifestyle modification. And then secondary, it will be the acute hospital physiotherapy, early mobilizations, respiratory care, post-surgical and medical stabilization. And then we have the tertiary care, which will be more the complex rehabilitation centers, specialized units like neuro rehab, burns, peds, and then orthopedics at a rehabilitation center. And then quaternary care, we are involved with transplants, ECMO, spinal cord injuries, and then also a big role to play in the palliative and the long-term support of palliative care. So physiotherapy is not tied to a specific age or condition or level of care. It is a lifelong process. Physiotherapy is uniquely positioned to influence the recovery at every stage, helping premature infants survive and thrive, supporting children to achieve development milestones, enabling adults to recover from injury, illness, or surgery, empowering older adults to maintain independence, and providing specialized and compassionate care in complex, high acuity and palliative settings. So the barriers to physio is very similar to the barriers of rehabilitation worldwide. One other thing, and I just want to say there what I mentioned about the COPD and the pulmonary rehab, they've actually a systematic review survey that they did through the WHO found that 3 to 16% of eligible COPD patients were referred to pulmonary rehab. Reasons of the under-referral include lack of knowledge about pulmonary rehabilitation, particularly among the general practitioners, and insufficient resources. So as this is the GP Expo, I would really like to encourage the GPs to start looking at rehabilitation with different eyes and actually see where that could actually benefit the patient. It's not incorporated into the physios are not incorporated into decision-making teams. I worked in the UK for 9 years, and there was one hospital where I was critical care was my speciality at that stage, and I worked on a critical care team where I was absolutely part of the decision-making team in the ICU. The doctors wouldn't have removed an ICD drain. They wouldn't have taken a trachea or anything if I haven't made the call that the patient is ready. So it was so great to work in a team where you're actually part of the decision making. And I came back to South Africa 23 years ago, and I just didn't experience that same feeling. And it was really hard because you do know that you have the ability to be part of it and to actually benefit the patient. So I think it's a lot different now. I don't work in hospitals anymore, so I think it's most probably different now with the time and the focus on multidisciplinary working, and especially now with group practices becoming a possibility. I think or multidisciplinary practices, I think it will change, but that is one of the unfortunate things why physiotherapy is not, or what's a barrier to physiotherapy. And then I just want to say the socioeconomic status of patients. It's obviously sometimes they have to really weigh up what can they afford and what they can do. So that is also a big barrier. And the solutions is education, advocacy, team approach, and then the prioritization of research to show the data so that the funders can say there's more money for the service. So physiotherapists are a constant thread through the entire rehabilitation journey, restoring movement, dignity, and hope across the lifespan. And then the final word is that to all the doctors here today is think rehab, think physio, because the difference is in our hands. Thank you very much.
Thank you so much. Do we have any questions? I just want to mention, like you spoke about multidisciplinary, and unfortunately, I don't know how many of you are aware of this, but the medical schemes have made a change now where a lot of the, it used to be that you could claim from different rehabilitation professionals out of different like baskets, so to speak, but they've now put it all together. So you've got a set amount. And so as a patient, you have to decide, do you use it for physio? Do you use it for OT? Do you use it for bio? What do you use it for? And there's like a limited fund, which unfortunately means that people are not getting that holistic, like
Absolutely.
you said, you know?
And where that is very obvious is now with one of the schemes with it is depression baskets. They've given 42 group sessions, but that's regardless who does it. So there's not 42 per profession, it's 42 for the whole year, and regarding if it's the physio, the OT, the bio, whatever that is, and the psychology, so everything comes out of that pot. So that is the problem. It's all thrown into one, and it's really difficult.
And then I'm just wondering, what do you think the role, the issue in South Africa is, do you find compared to the UK? Because I know even when I worked in the UK, the difference is that we tend to work in silos in South Africa. Like, what is your perspective on?
Yeah, so I worked in private and the NHS in England, and obviously in the National Health Service, it was a lot about teamwork. We had discharge meetings where the whole disciplinary team would sit there, and we will all have our input. Is the patient ready to go? Not. So again, it was a lot of be part of the decision-making team. It is definitely different here. I haven't worked in the government here, so I can't say if it's different there. But in private here, it's definitely a lot of silos. It's definitely different. The private there was also fairly physio siloed, but less so than here. It was, at least you were still part of a team and you did still interact together.
Okay, do we have any questions? No questions?